Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist, I have given almost all the topics in a very systematic order. You can make use of it. My dear friends, so today onwards we will going to start another important topic in pediatrics, that is nephrotic syndrome. So in this chapter, so we will see in the beginning what actually the nephrotic syndrome and what are all the explanation given for the nephrotic syndrome in the contemporary medical science. Later onwards we will see how to tackle this problem through Ayurveda and what are the possible line of treatment, principles of treatment, and as well as some of the medications, and to what extent we can offer recovery to the kids. So that we will discuss in the subsequent classes. So we shall start this topic now. Now the basic question is, what is actually the nephrotic syndrome? As we know, nephrotic syndrome is a condition which is importantly associated with the three important aspects. Number one is there will be massive proteinuria. A lot of protein has been passing through the urine, especially albumin. And as a result, there will be hypoalbuminemia. In the blood, the albumin level will going to fall, because the maximum protein, the maximum amount of the protein which is going out, that is basically albumin, and therefore in the blood you will going to get hypoalbuminemia. Okay, so one is massive proteinuria, hypoalbuminemia. So usually the albumin which is present in the blood is about 2.5 grams per deciliter, but in this case it is less than this. Okay, so third important is edema. Edema, that is generalized anasarca, will be there all over the body. There will be edema. The edema first begin with the orbital region, periorbital region, and then gradually it spread to the other parts of the body. So generalized anasarca is there. So why this generalized anasarca is there or edema is there? That is because of the loss of protein. The loss of protein which is happening, the loss of protein in the urine leading to less protein in the blood, less protein in the blood. So that leads to this problem, and this protein actually is very important for maintaining the plasma oncotic pressure. So if the plasma oncotic pressure is not maintained properly, then the pressure inside the blood vessel will going to fall or get disturbed, and that leads to edema. Another important is a hyperlipidemia. So there will be hyperlipidemia because the body is losing the proteins more, and as a result, because of the protein loss, liver has to work more. Okay, so liver has to work more. That means some amount of the lipids are get converted into proteins, and in the process, lot of the fat derivatives are released into the blood, like cholesterol. If the cholesterol is utilized to get convert itself into some of the proteins, so cholesterol has to undergo dissociation. Therefore, there will be fatty acid and cholesterol, fatty acid and glycerol will be formed. Okay, so you find usually in the blood hyperlipidemia or hypercholesteremia will be seen in the blood. So these three are considered as a triad of nephrotic syndrome. You have massive proteinuria, you have got hypoalbuminemia, and we have got generalized edema and hyperlipidemia. So hyperlipidemia, especially serum cholesterol, anything more than 200 milligram per deciliter. So in general, this is very superficially I am explaining. In general, these are the four important symptoms which are seen in nephrotic syndrome. Why it is happening, how it is happening, that we will see later. Okay, especially in the children when we talk, a protein excretion of 40 milligrams meter square per hour, or about 3.5 grams of protein loss in 24-hour urine specimen. That means you collect the urine, 24-hour urine, and look at how much of protein is there in that particular urine. If it is more than 3.5 gram or 3.5 gram or more than 3.5 gram, in some of the books it is given even 2.5 like that. So anyway, we will take 3 to 3.5 grams. So then it is referred as nephrotic syndrome. So this particular proteinuria, where protein loss is more than 3 grams or 3.5 grams, then it is called as a nephrotic range of proteinuria. Nephrotic range of proteinuria. So this is the basic thing about the nephrotic syndrome. Now, Now we come to the basics again. the first slide is just about the introduction. Now, what is nephrotic syndrome? Nephrotic syndrome is basically it is caused by many disorders. Nephrotic syndrome is basically caused by many disorders. Now we classify the nephrotic syndrome basically into two parts. Number one is primary nephrotic syndrome and another one is secondary nephrotic syndrome. Now what do you mean by primary nephrotic syndrome? Primary nephrotic syndrome is, as the name suggests, it is basically because of the involvement of the nephrons. Primarily there is involvement of the nephrons. None of the other causative factors or outside factors or other systemic factors are responsible for that. The disease nephrotic syndrome is caused by exclusively because of the causes related to nephron or kidney. So that is called as primary nephrotic syndrome. Okay. So this may occur either because of the disease of the glomerulus, that is also the part of the nephron, or it may be because of the collecting tubules or proximal tubule, or sometimes it may be some other parts of the kidney. All these factors are included under the heading of primary nephrotic syndrome. Now what about secondary nephrotic syndrome? Secondary nephrotic syndrome, this is due to the conditions that affect the kidney and also other parts of the body. Okay, if some other part of the body is having some problem, because of that the kidney is affected and that leads to nephrotic syndrome. So all such, or maybe some of the toxins, or maybe some of the drugs, maybe some of the metabolic derivatives, okay, or if they are causing the problem leading to the nephrotic range of proteinuria, so then it is called a secondary nephrotic syndrome. Now first we shall see the primary nephrotic syndrome. What do you mean by primary nephrotic syndrome? Primary nephrotic syndrome, there are so many classifications are there. Okay, so one of the most common classification that we use in primary nephrotic syndrome is histological based classification. Okay, so histological based classification. So that divides the primary nephrotic syndrome into four types. Histological, primary means related to kidney and nephrons, and now again it is of four types. One is minimal change in nephrotic syndrome, another one is focal glomerulosegmental sclerosis, which is very common in adults. Another is membranous glomerulonephritis, MGN. Another one is membranous proliferative glomerulonephritis, and another one is rapidly progressive glomerulonephritis. So these are the four types of primary nephrotic syndrome, where the involvement is in the kidney and nephrons. None of the other body parts are get affected. Okay, so the first one is minimal change nephrotic syndrome or disease. What do you mean by that? This minimal change nephrotic syndrome is very, very common in children. Okay, it is very, very common in children. And why the name minimal change nephrotic syndrome is given is, if you look into the investigations, you go for renal biopsy or you go for the ultrasonography, etc., even CT scan, etc., you cannot find any findings. Okay, there is very minimum finding, minimum change in the structures of the kidney or nephrons, but still the problem is there. Problem is there. There is nephrotic range of proteinuria is going on and all the other triads are there. But if you look into the kidney especially properly, and there is no much changes are seen, or if at all seen, it is minimum. So therefore the name given as minimal change nephrotic syndrome. Okay, although all the symptoms of nephrotic syndrome is there, investigation wise, biopsy wise or CT scan wise, you cannot find any much significant findings. So therefore the name minimum change nephrotic syndrome is given. This is one of the major type of primary nephrotic syndrome, and this is very commonly seen in children. This is very commonly seen in children. The other types are focal glomerulonephrotic, which is glomerulosegmental sclerosis. This is quite common in adults. Okay, this sometimes it is also called as maximum change nephrotic syndrome. Here you find some of the finding in the biopsy and CT scan. Okay, therefore it is also called as maximal change nephrotic syndrome. It is also called as focal glomerulosegmental sclerosis. Another type is membranous glomerulonephritis, and another type is membranous proliferative glomerulonephritis, and another type is rapidly progressive glomerulonephritis. All these are considered under the heading of primary nephrotic syndrome only. But as far as the children is concerned, for us very important is minimal change nephrotic syndrome. So in the next class, we will discuss about secondary nephrotic syndrome. Thank you very much.